Hi, I'm Dr. Rita Kathawa, bariatric medicine specialist and founder of Michigan Weight Loss Institute.
And I'm Dr. Marissa Baca, a board-certified plastic surgeon at the Straith Clinic. And this is a New You by Us Too.
And we're here today to continue to bring you more information on the topic of medically assisted weight loss and surgical options afterwards.
Absolutely. And today our focus is going to be doing a deep dive into some of the body contouring surgeries that are available after you've achieved your weight loss.
So tell us, Dr. Baca, what's your personal approach to body contouring?
Sure. So a lot of times when I'm working with a massive weight loss patient, we're not talking just one area or one surgery. So it's really having an in-depth discussion with them about their goals and their priority list. For some people, tummy is their absolute number one on their priority list. For other people, it's arms. So that really kind of comes into play on how we look at our plan and our outlook, but either way, it's going to be, in most cases, a multiple surgery, multiple step process. So starting with that priority list, figuring out which areas are most bothersome to patients, figuring out which areas can be combined, and then kind of making that plan. So, okay, we're going to start perhaps with breast and tummy. Next, we'll move on to arms. Next, we'll move on to thighs. Or which areas combine well. So the upper back and the breasts combine well, or upper back and arms combine well. And also it depends on their individual needs. So if we're talking tummy and it's a standard tummy tuck, that's far easier to combine with breast surgery, for example. But maybe we're talking a circumferential tummy tuck or a fleur-de-lis tummy tuck, some of the more specialized ones. And maybe those are best recovering just on their own before we transition to the next step in the process. So really taking that bird's eye view of what our overall plan is going to be is the first step in developing a surgical solution that's tailored for each patient's individual needs.
Yeah, that's logical in terms of, your operating space and also the patient's recovery afterwards. So
definitely.
So maybe guide us through abdomen.
Sure.
That tends to be a big problem area for both men and women.
100%. I would say abdomen is probably the most frequent number one on the priority list. It affects most notably how we feel in clothing and bathing suits and things like that. And it's often one of the biggest pieces of skin too. So, getting rid of that can make a dramatic change to patients' lives. And so it kind of gets back to what ways were the skin stretched in the beginning. So starting out when you're at your heavier weight, again, three-dimensional thinking. It's not typically, in many people, it's not stretched in just one direction. It's kind of stretched in 360 degrees all the way around their trunk. So as a plastic surgeon, I have to look at where their laxity is and make sure that we're tightening it in the ways that are going to address all those areas of laxity. So your standard tummy tuck is really, for the most part, just pulling down on that vertical laxity. And then there's something called a fleur-de-lis tummy tuck, where we're pulling down and in. So we get that downward pull, which is that low scar, but then we also get an inward pull for any of the horizontal laxity. The trade-off is the fleur-de-lis involves a vertical scar, but in patients who need it, it really dramatically affects the body contour that we can achieve, because we can really showcase that body underneath when we're able to pull out that horizontal laxity if it's needed. And then the other question is, do we follow that tummy tuck around circumferentially, or sometimes this is called a lower body lift. So in a traditional tummy tuck, we're stopping the scar at the ends where the skin excess ends. But oftentimes in a massive weight loss patient, their skin laxity extends around to the back as well. So the better option in that patient might be to continue the excision all the way around. So that's that circumferential tummy tuck, circumferential abdominoplasty, lower body lift, many different names for it. But the idea is that the scar goes all the way around so we can get rid of that loose skin all the way around. And then sometimes, to complicate matters further, we combine that with a fleur-de-lis abdominoplasty. So we pull down all the way around, and then we also pull in the center here. And again, it just depends on each patient's individual anatomy and where their laxity is to determine what best suits them.
Now, for example, certain patients that maybe have had a cesarean section or previous scars, are we able to hide new scars where the previous scars lay already?
Yes.
Is there options?
Or oftentimes we're getting rid of those those previous scars, I should say. So many of my patients have C-section scars. And usually where I'm starting my incision for the front of the tummy tuck is even lower than that, because we want that nice low scar that's well hidden in underwear or a bathing suit. So in the process of doing the tummy tuck, I cut out your C-section scar. So I'm only leaving you with one scar instead of multiple scars.
That?
100% is another great benefit.
Oh, women would be happy to hear that one for sure.
Yes. Well, and because, sometimes that C-section scar ends up being a tethering point. It's kind of where maybe that scar is kind of stuck down to the underlying layers of our abdomen. And so we really see that fold over of the skin on top of it. So part of the surgery in and of itself is just kind of smoothing everything out, tightening everything, and then getting rid of that old scar too.
That's good to hear. Sometimes, we have patients that had emergency C-sections or, like life-threatening conditions. So that surgery was a little bit rushed. So they do have some residual scars that they're unhappy with. So that's a really good option to know about. And then maybe the next area to touch on potentially is the breasts.
Yes. Another area that's usually pretty high on patients' lists. And again, it comes to what are they presenting with and what's the problem. So oftentimes with massive weight loss, we see some degree of what we call ptosis, or sagging, drooping of the breast. Because at one point they were larger in volume. Usually, along with the massive weight loss, patients have lost volume in their breast, and the skin hasn't accommodated all the way, so we get some looseness. So in those patients, we need a breast lift. So we're going to rearrange that soft tissue envelope to make a tighter, lifted, perkier envelope. And then the question is, what is their volume status in their breast, and what do they want it to be? So some patients, even after the weight loss, still have large breasts and are uncomfortable with the large side of their breast. So maybe we're also removing some of that volume in the form of a breast reduction at the same time as doing the lift. So now they have a breast that can better match that overall smaller size of their body. On the other side of the spectrum, we have patients who seem to have lost all the volume in their breast in the process of massive weight loss, and they're looking to bring some volume back. And so we can do that in a variety of ways. The most predictable way, if we're looking for a larger size increase, would be with an implant, and that can be combined with a lift. Maybe we don't need an overall size increase, but we're looking at maybe just enhancing the size in some areas. For most women, that's kind of the upper portion of the breast that they're looking to enhance. So maybe we're doing some fat grafting in that area to just give a little bit of a volume boost.
More natural looking boost.
Correct.
And the upper poles of the breast.
100%. And some women are uncomfortable with the idea of an implant and would rather not, and would rather just have their own tissue. And that's where fat grafting can come into play as well. So usually most of my massive weight loss patients need some component of a lift. And then it's just, does the lift alone do it? Do we need a lift and a reduction? Do we need a lift in to add some volume? And that comes down to mostly personal preference.
Now, while most breast concerns tend to come from women, there are a handful of male patients that after massive weight loss are very uncomfortable with droopiness of tissue around their breast. So are there options for male patients as well?
Absolutely. And the male patients deal with some of the same issues in that when they were at their heavier weights, maybe they had more volume in their chest. And then as they've gone through the weight loss process, that volume has gone down, but the skin hasn't snapped back at the same rate. So maybe they have what appears to be almost a drooping breast because they have that excess skin. So oftentimes gynecomastia surgery is the term that gets thrown around to all of it, but maybe the more accurate term would be chest contouring for men. And so maybe we're cutting out the excess skin of the chest. Maybe if they do have a little bit of gynecomastia, which is kind of some fibrous breast bud type tissue there, maybe we're doing that as well. Oftentimes we're doing some liposuction to kind of fan out the residual fat just to make sure everything is kind of flowing into a nice contour. So there are absolutely options for men as well.
That's really good to hear, because we see so many different patients, some that are looking to take off, like you said, massive weight loss patients, you know, more than 100 pounds, more than 150 pounds. But sometimes we also have, you know, patients that want to just improve their appearance, and maybe they're not obese to begin with, just slightly overweight. We have male patients, we have female patients.
Absolutely.
So it's good to hear that there are options for.
Yes, there are options for everyone.
Yeah.
It's always a discussion to see where you're coming from and where your goal happens to be, and then what we can provide from a surgical option for sure.
Thank you. Really good information. And then briefly maybe touch on thighs, and the inner thigh area I know is a huge issue for a lot of my patients, especially when they're wearing shorts and they have all this extra skin in the way, or it gets, you know, caught in clothing again. So maybe we can discuss that a little bit too.
Definitely. Thighs are up there on the priority list as well, because you're right, there's such a functional component to it. You know, you're walking around, you're doing the things you would normally do in everyday life, and the excess skin is really rubbing, it's bothersome, it's annoying in clothing. So what most patients who have lost a significant amount of weight will need is some form of what we call an extended medial thigh lift. So that's when the scar is going to go kind of along the groin crease, and that part's hidden pretty well in the bikini. But there is also a vertical scar that kind of goes down the inside of the thigh. Now, we try to place it in a way that when you're looking from the front, it's not necessarily visible. And between surgical technique and some of our scar treatment modalities, the goal is to get that scar to heal as best as possible. But that's maybe one of the big trade-offs for the thigh lift, is that the scar can be pretty long, but the results can be really amazing in that it's just getting rid of the loose skin on that inner thigh, tightening everything up. A lot of times I'll end up doing some liposuction contouring at the same time as a thigh lift, because thighs might be one of the places of stubborn fat pockets where people still hold on to some weight. You know, they've done such an excellent job losing weight everywhere else, but they still kind of have some excess volume on the front of their thighs. So I'm doing some liposuction contouring there, while also doing the thigh lift to kind of just smooth, tighten everything, decrease the circumference, make it easier to wear shorts and pants and things like that. Now, the outer thigh isn't so much addressed with the medial thigh lift. Where the outer thigh comes into play for many patients is when we do that circumferential component of the tummy lift, where we're bringing that lower body lift or circumferential tummy tuck from the front, but bringing it all the way around. That kind of captures the lateral thigh, and it does a great amount of lifting of the lateral thigh as well. So that's kind of sometimes a two-part process for many patients, but can be very helpful.
And that's why it's always best to just, you know, take advice from your surgeon, because they know the best way to talk. You know, you come in with your concerns and then always try to see if there's some guidance from your surgeon about how to approach it.
Definitely. An open and honest conversation, I think, it is the best way that we can talk with our patients, so that they can tell us really what is bothersome to them, and then we can tell them where there are options to help improve that area.
And another benefit from surgery that I see too is with soft tissue infections. You mentioned the breast, the droopy breast, the excess skin at the bottom of the abdomen, in between thighs, rubbing on each other. I see a lot of irritation there, fungal infections, just sweating, and that area really doesn't react well to moisture. So that skin fold, eliminating that skin fold, really helps. Even in good hygiene, it still can happen.
Definitely.
So that's definitely a big benefit of removing excess skin as well, wouldn't you say?
I would say, yeah, definitely. There are some really awesome benefits that kind of come along with the plastic surgery, you know, outside of the obvious benefits of contouring and whatnot. One big one that we see a lot has to do with our tummy procedures. Almost everyone with some form of abdominoplasty will most likely need what we call a diastasis recti repair. So when you have your six-pack muscles, oftentimes either with pregnancy or with weight fluctuation, those muscles kind of separate a little bit in the beginning. And now your muscles are out of anatomic alignment. Those muscles that are supposed to be your core, which is so important in so many of the activities you do, are just not pulling in the way that we would want them to. Sometimes that can cause some low back pain. Sometimes that can cause other issues. And so as part of the tummy tuck, those muscles get brought back together in the center. So it reestablishes their anatomic alignment. And people, I think, are often surprised by the ways in which that benefits from. They feel just stronger in their everyday activities. They can feel that their core is engaged when they do things. And a lot of times that translates to some improved low back pain. I've even had patients say that they had improved urinary continence after things like that. So
For sure, yes.
no way to underestimate the importance of the core. And so if we can bring that core back to where it should be, it can only help us, that's for sure.
Arms, briefly?
Yeah.
Anything you want to mention?
Yeah. So arms can be a big thing for patients. Again, it really comes back to a lot of times fitting in clothing. So they've lost weight everywhere else. Maybe they've gone down in clothing size everywhere else, but that loose skin hanging from their upper arms makes it difficult for them to fit their arms in the sleeves of clothing. And so that's where a brachioplasty or an arm lift comes into play. Usually the scar there travels from the inside of the armpit down to the elbow. So again, it's a longer one. But again, I try to place that scar so that it's concealed kind of against your body. So when you're standing with your arms, at your sides, it's not necessarily visible from the front. Maybe it peeks out the back a little bit, but for the most part, it's kind of against your body. So those tricks of concealment just make it a little less apparent. And then again, scar modality, scar treatment comes into play to try to make that a nice thin line scar that just doesn't draw people's eye as quickly.
I love that you're so cognizant of scarring. I mean, some people, rarely, but if they have a condition that, maybe is sensitive to scarring, like keloids.
Sure.
We do treat some keloids because I do have a lot of surgical patients. So for the most part, the benefit of surgery outweighs the risk. But I love that you work with patients very closely and are cognizant of scars. And
Definitely. And I think that's an important part of the consultation is being very upfront with patients on what the scar is going to look like. Because for some patients, just depending on where they lose their weight, let's say they have a little bit of skin laxity on their arms, but not too much, an arm lift might not be the right option for them. Right. The improved contour that we get for that little bit of a lift might not be worth the long scar. And so that's where, looking at photos and kind of getting a real life view of what might this look like on me and on my body, I think is a very important discussion to be having with your surgeon.
You mean we shouldn't just bring you pictures of celebrities and ask you for their procedures?
Not necessarily, although I do love a good wish picture. So a lot of plastic surgery does seem a little bit, abstract. It's theoretical. We're talking about tightening and lifting and enhancing. But my idea of what all that means might be different from what you have in your head. Yeah. So if you show me a picture, I kind of see the gears working in your head. I see what you're envisioning. And then I can either tell you, oh, I see this aspect of that picture. I think we can make that happen. Or I can also look at that picture and say, your anatomy is different in these ways. I don't think we can exactly make that happen. So it's all about that discussion and getting on the same page as your surgeon.
Definitely. For sure. Thank you so much, Dr. Baca, for the wealth of information and sharing your expertise with us. It's really been helpful. Thank you.
I do love what I do. So I hope you enjoyed hearing a little bit more about a deep dive into some of the different body contouring procedures that are available after weight loss. And remember to look to our social media and our websites to tune in for more episodes and past episodes. And as always, contact us if you have any questions.